Child Obesity in Mississippi by Brandy, Donna, Angela, Samantha, due March 16th. Community and Public Health Instructor Brandy Merriweather. Childhood obesity is one of the major health problems affecting not only Mississippi, but also the entire United States. However, Mississippi is one of the mainly affected areas. The fact that 40% of the children in the state are obese is evident that the situation is dire in the state. Nevertheless, Mississippi State Department of Health has established measures to ensure that the situation is managed effectively and sustainably. Child obesity in Mississippi is a prevalent problem which needs to be addressed at once because of its serious consequence on health, academics, and the economy. It is encouraging, however, to note that the state has launched policy objectives to guide schools and families in the aim to curb obesity among school-age children. Why is obesity a serious concern in Mississippi? According to Mississippi State Department of Health, obesity among children is a leading health concern. As of July 2009, Mississippi is officially the leading state in childhood obesity, a full 6.9% higher than the second place. The Mississippi State Department of Health also notes that 40% of children living in the state are overweight or obese. Obesity rates by district. In the survey by Mississippi Kids Count in 2014, the percentage of obese school children ages 4 to 18 are as follows. You can see on the map that District 3 is actually the highest percent of 26.5, and District 9 is the lowest of 16.9%. Interestingly enough, even the lowest rate is almost near the national rate of 17.3% for childhood obesity. According to research funded by the Trust for America's Health and the Robert Wood Johnson Foundation, 13.9% of children ages 2 to 4 are obese. On the other hand, the report by the Mississippi Kids Count shows that 33% of children between the age bracket of 4 and 10 are obese, while 20% of children ages 11 to 13 are suffering from obesity. The impact of obesity. The obesity problem has severe consequences on children and the economy. According to the report compiled by the Power Initiative, a program by Mississippi Department of Education's Office of Healthy Schools, obese children tend to miss more school days and have lower academic performance. The report also shows that 80% have the chance of being overweight and obese when they become adults. Further, they are at risk Further, they are at risk of incurring chronic diseases that lead to disability or premature death, such as coronary heart disease, type 2 diabetes, heart disease, hypertension, osteoarthritis, sleep apnea, many cancers, and other conditions. On a national level, obesity among children costs Medicaid more than $3.9 billion every year. The existing policies. Mississippi still lags behind the rest of the nation, but continued commitment to full implementation of coordinated school health through existing state policy can help the current generation of children grow to be fit and healthy adults. It means that obesity can be solved. First, it has endeavored to improve the built environments to promote physical activity in communities. This policy is aimed to encourage physical fitness in Mississippi. Secondly, the state aims to replace fryers with combi ovens in school kitchens. This is to promote better diet and food intake in school. A third objective is to increase the number of school nurses in the schools so that kids' health can be monitored regularly. And in line with this, the fourth policy is to support comprehensive fitness testing in school. The fifth policy is to improve state standards for daycare centers and youth programs to promote healthy lifestyles so that schools will make it a part of the child's daily routine. The sixth policy also regulates better food choices, encourages recipients of public benefit programs to purchase healthy foods. In order to push this agenda, the seventh policy is to control media advertisement in order to restrict advertising of unhealthy foods to children. At the same time, this policy will require public service announcements that offer healthy messages. We all know how susceptible children are to the advertising that is geared toward them. If we make it toward healthy options and activities, maybe they would desire that rather than the junk that they see. The eighth policy objective is to require schools to provide BMI, which is body mass index reports to parents. This is so that parents will be well aware of their child's health conditions and properly address indicators of obesity. Ninth, the state will promote improved access to supermarkets and its products so that accessibility to better food options are available to all. Finally, the 10th policy objective is to require labeling of menus and prepared foods. Having mentioned the policy goals, that the state of Mississippi will implement, it is evident that diminishing obesity can be accomplished if the state, schools, medical institutions, and the home cooperate. But performing this will be efficient only if there is accurate monitoring of health and diagnosis or investigation of the issue. Based on the above policy goals, the state can monitor and diagnose health of children by increasing the number of school nurses, which is Policy 8, and require schools to provide BMI reports to parents, which is Policy 3. How about children who are not in school? The state must require all parents or guardians to submit their BMI reports of their children to the nearest health center. The health center will be the focal point of the public health monitoring so that the state will know which districts have the highest incidences of child obesity, investigate possible reasons, and address the causes before it's too late. Basically, at each child's checkup or at the school, these numbers would need to be reported to the state in order to monitor the child's health as a whole. Individual states retain much of the power to influence policies and regulations in the United States. Through legislative and regulatory actions, state governments are able to wield substantial power over specific actions that affect public health. Nationwide programs such as Let's Move and other bringing awareness to childhood obesity are a catalyst to provoke everyone to get involved in the health of our children. Taking these steps now will lead to healthier lifestyles and reduce the risk of children being predisposed to chronic illness that are associated with weight when they get older. Having access to healthy foods and being able to eat balanced meals will help alleviate some of the implications of obesity on children and the economy. Health and balanced meals not only fuel our bodies, but also help fuel our brains. With that in mind, take a look at school cafeteria food from around the globe and ask yourself, how does the United States measure up? So far, it's not looking good for the home team, but that can be changed with the correct policies to make sure that nutrient-dense foods, in other words, not processed foods, as our plate shows, are available to all children, regardless of race, sex, age, or family economic status. Also, developing policies that hold those that are in direct contact with the child accountable for their health. With rates of obesity and overweight reaching 50% in southern rural communities, intervening early in development may offer the best outcome because of the difficulties with changing lifestyle behaviors later in adulthood. A population-based approach is recommended over a targeted approach to cultivate a culture of healthy lifestyle behaviors when children are developing their health habits. The International Obesity Task Force recommends instead that we focus on preventing unhealthy weight gain before it develops. Theorists and clinicians recommend using social learning theory to achieve this goal because it addresses the dynamic interaction between the individual, her behavior, and the environment, rather than focusing on just the individual and his or her eating behavior. Intervening early in development should yield the best results because lifestyle habits are established early in childhood. Utilizing a population-based approach appears to be the most promising because of the economical, it reaches more people, and individualized treatment programs have proven effective longitudinally. When in development phase of creating policies to address childhood obesity, it is important to consider the everyday environment that the children are in and use that environment as a gateway to create partnerships with the potential stakeholders, those that have a day-to-day interaction with the children. Schools are ideal environments in which to make changes that will help children form lifelong healthful habits. Getting physicians to engage parents in their child's health is pivotal to the success in the fight against childhood obesity. Physicians' public roles have been defined as an advocacy and participation in improving the aspects of communities that affect the health of individuals, and they have a primary ethical and professional responsibility for the health of the community members they serve. Also, getting the parents involved and possibly enacting consequences on the parents that are not making an effort to support healthy lifestyle for their children. An example of a policy that is already in place would be school absences and tardiness. Some school districts hold the parents liable for all missed days, and if the student gets past a certain point, the parent can be arrested. Regarding childhood obesity and a healthy lifestyle, the consequences may not have to be as severe, but a policy in place along those lines to hold the parents responsible for the food that their child eats and the physical activity the child is involved in. There are leaders and organizations within the state of Mississippi that can assist with the policy development. The three we have chosen are elected officials, public health officials, and the local health department staff. This group of people was selected because they can provide the manpower to do the research and implementation for policy development. The health department can then work with more local organizations and community members to share the policies and provide the resources to local organizations to put them into place. From here, community members and local organizations can engage parents, physicians, schools to help educate and encourage children on the level that they can comprehend. Making healthy lifestyle changes a fun activity that gains and keeps the attention of children is the ultimate goal. The lifestyle changes, if presented properly, will have a lasting effect on youth, promoting healthy living into adulthood. Being able to effectively inform, educate, and empower the state of Mississippi when it comes to addressing the issues of childhood obesity will start from a government level. This will start with mobilizing community partnerships. State and local officials have the resources to be able to gather teams to address issues in the community. Starting with a diverse panel to do the research and create a partnership with the stakeholders will lead to creating lasting partnerships in the community. Once these partnerships has been created, then they will be able to properly inform, educate, and empower the community. The information being given to the public needs to be accurate and not cause a panic among the people. It's not wise to use scare tactics, but presenting the facts to educate the public on childhood obesity, what it does to their bodies and minds, and how it affects the future and ultimately the future of our nation will empower the people to make better health choices. Additionally, once the research surrounding childhood obesity has been compiled, state and local officials can then begin to develop and implement policies that will promote healthier lifestyles in the early years of childhood obesity.